The focus for cardiovascular imaging really in one simple sentence, it's our vision. It is essentially to detect heart disease as early as possible before it strikes, and also to help our clinicians and researchers to find a cure for heart disease. Imaging is important for heart health because if you think about it, cardiovascular imaging forms the backbone for all cardiovascular evaluations for patients when they come to see us. In other words, no patient goes through a cardiac evaluation without having some type of imaging of their heart. The beating heart evaluation, it could be as simple as an electrocardiogram or an echocardiogram, a CT or an MRI scan, but essentially without cardiovascular imaging, we won't be able to make the accurate diagnosis at the right time and help our clinicians and researchers to treat the patients. So cardiovascular imaging forms the backbone of everything we do in cardiology. And having access to great cardiac imaging makes a big difference for patients. For example, when patients come to see me in cardiology, they come with worry about their heart, and they ask me, can you make the right diagnosis here? And that's a big concern for patients and their families. So when that happens, I think all they're really asking us is, can you tell me something that'll make me live longer? And can you help me pick up disease that hasn't been picked up? And with the new techniques that we have available, our goal is to really detect heart disease as early as possible, and also when people already have heart disease, to figure out a way to let their clinicians and the doctors know what they could do to improve their chances of survival. So I think, without cardiovascular imaging, there is no cardiology. Imaging at the university includes a variety of imaging techniques, and we've done something very unique that only a handful of centers in the country have been able to do, which is to put every imaging technique available within easy access to patients in the same physical space. Traditionally, imaging includes various techniques like ultrasound or CT or MRI scans in different parts of the buildings or different parts of the system, but it didn't make sense for our patients because we are a large quaternary care center, and patients come to us not just from the local area, but also from a lot of referral centers. And in order to make the patient experience as easy as possible and also offer them access to the best imaging modality individualized to their condition, we realized a few years ago that putting them all in the same physical space and bringing all the specialists in imaging to that area would make it a seamless experience. And I think we've been able to break down those barriers very successfully. And when patients come to the University of Minnesota, they access the most basic imaging technique to the most advanced imaging technique all in the same area. We also have our trainees, our next generation of physicians being trained, seeing all of this open communication happening between different specialties like cardiology, radiology, surgery, all looking at the patient's images, a beating heart, a three-dimensional image or a four-dimensional image, and trying to decide what can be done for these patients. So I think we have a very unique setup under one roof to enable the right diagnosis at the right time and also with the right technique. I see great things for the future of imaging, and I can't pick on one thing, but we are seeing a big shift from making diagnosis without even putting a needle in a patient. In the past, or even now, we do a lot of surgeries, we do a lot of biopsies, we do a lot of invasive interventions to diagnose a disease or treat a disease. Imaging, I think, is in a very exciting time now because we're taking that all away and telling the patient, look, we could do the same thing without even touching you. All we want you to do is to sit in the scanner or lie down in the scanner, and we can figure out what is happening with your heart while it's beating and try to direct your physicians to picking up the right diagnosis here. And then if something really needs to be done that we can't do with imaging, you might get an intervention, you might get a surgical intervention. But I think the next 10 to 20 years in imaging will be the golden era because as technology improves, as we go to more and more advanced computer processing algorithms, we'll be able to tell what's happening in the body at a cellular level without having to get tissue. So I think we are at the right time with the right technology and with a great team at the University of Minnesota.